everyone. Thanks for joining us. Thank you for joining us for the ACEP Capital Minute. Look at what's happening right now that's affecting emergency physicians and patients. I'm Laura Wister. For the next 30 minutes, I'm going to give you an update of what's happening in our nation's capital, and then we'll open it up for questions. You can submit them at any time during my update by using the Q&A feature at the bottom of your screen in Zoom, and then I'll answer them live after my update. Here's a taste of what we'll cover today, such as the Krishnamurthy Mental Health Bill, HELP's hearing on pandemic lessons learned, liability protections, an update on the ACEP AUCM model, and a reminder on NEMPAC's charity match. We're kicking off today with an update on a continued priority for ACEP, physician mental health, and breaking down barriers for you to seek treatment when you need it. On Thursday, June 18th, the Coronavirus Healthcare Worker Wellness Act, HR 7255, was introduced in the House of Representatives by Raja Krishnamurthy, John Katko, and Frederica Wilson. ACEP worked closely with Congressman Krishnamurthy and his staff to develop and inform this bill that establishes a grant program to ensure emergency physicians and other frontline healthcare providers have access to the mental health resources they need during the COVID-19 pandemic. The legislation builds upon Representative Krishnamurthy's recent bipartisan efforts, which included a bipartisan letter we told you about with nearly 100 signatories, to highlight the mental health challenges posed by the unprecedented scale and impact of the COVID-19 response. In addition to establishing a grant program to provide funding and resources needed in the more immediate term, the legislation also directs the Secretary of Health and Human Services to commission a study to examine the factors that contribute to poor mental health and burnout, potential barriers to treatment that may exist for healthcare professionals, and recommendations on effective solutions to address these challenges. ACEP continues working to ensure that emergency physicians have access to the resources and care they need during these exceptionally challenging times, including efforts to introduce companion legislation in the Senate and to ensure that these provisions are included in any future COVID-19 related legislation considered by Congress. Even though we are still in the throes of this current pandemic, lawmakers are beginning to think of the nation's response to the next global pandemic. As you may remember, the Senate Health, Education, Labor, and Pension, or Health Committee's Chairman Lamar Alexander asked ACEP for input on a draft pandemic response white paper. On Tuesday, the committee also held a hearing on lessons learned to prepare for the next pandemic. While there is general bipartisan support for further congressional action to address COVID-19, different aspects of the pandemic were emphasized by each party, such as the location of manufacturing, racial disparities, federal guidance, and whether federal or state control should be the primary feature of the response. Emergency physician and ACEP member Dr. Joni Caldoun, Michigan's chief medical executive and chief deputy director for health, was one of the witnesses at the hearing, and much of her comments focused on racial disparities and issues related to PPE. Also on Tuesday, the House Energy and Commerce Committee held a hearing to examine the Trump administration response to COVID-19. Witnesses from the CDC, NIH, HHS, FEMA, and the FDA testified. Not surprisingly, Democrats generally criticized the administration's response and called for more public science and data regarding the virus, while Republicans defended the White House's actions and emphasized the need to reopen the country. ACEP continues to push for congressional support of the Coronavirus Provider Protection Act, which would establish liability protections for emergency physicians, other providers, and health entities during the declared crisis. There are currently 7 bipartisan co-sponsors and several more Republicans waiting to be added once additional Democrats agree to support the bill. The sponsors of the bill are trying to maintain an even ratio of party backing to show broad support as they push to have their legislation considered in the next COVID relief package. In addition to COVID-19 related issues, I also want to update you on ACEP's efforts to promote the first emergency medicine focused alternative payment model, the Acute Unscheduled Care Model, or AUCM. We actually like to call it the AWESOME model. This model, developed by ACEP, puts emergency physicians in the driver's seat as payers move away from fee-for-service towards more value-based payments. The goal of AUCM is to improve the ability of emergency physicians to reduce inpatient admissions and observation stays when appropriate through enhanced care coordination. Emergency physicians would become key members of the continuum of care as the model focuses on ensuring follow-up care for emergency patients, minimizing redundant post-emergency department services, and avoiding post-ED discharge safety events. Essentially, the model would reward emergency physicians with the ability to earn higher payments for doing what you already do so well. While we wait for CMS to adopt the framework for Medicare, ACEP has started an initiative late last year to promote participation in emergency medicine-focused alternative payment models like the AUCM by other payers beyond Medicare, and we've already made headway. ACEP developed a suite of materials such as talking points and a fact sheet to educate emergency physician groups, private payers, and state Medicaid agencies about the AUCM and help key decision makers see the value of implementing an emergency medicine-focused APM. We were able to test out these materials during some recent conversations with multiple payers, large and small. And I'm happy to report that there's already early interest in the details of the AUCM to better understand how payers can integrate elements of the model into their existing programs and contracts with emergency physician groups. To learn more about it, you can go to acep.org/APM. Shifting gears a bit, I wanted to give you an overview of a public awareness campaign that ACEP is currently running. We've heard anecdotally from you all, and we're seeing data about the impact COVID-19 is having on patient volumes in EDs across the country. In April, ACEP conducted a public opinion poll with Morning Consult, which found that nearly a third of respondents were delaying seeking medical treatment for fear of contracting the virus. Just this week, the CDC released data that show in the 10 weeks since the onset of the pandemic, national ED visits declined 23% for heart attack, 20% for stroke, and 10% for hyperglycemic crisis. In addition to still getting major news coverage of this poll, ACEP is now running a paid digital ad campaign to educate the public on ways the ED is adapting to COVID. We're also developing a statement in conjunction with the Emergency Nurses Association and other key national groups with this message that should be out shortly. Lastly, as we approach the end of the month, I wanted to remind everyone that June 30th is the deadline for our first NEMPAC charity match. Given all that's going on, NEMPAC wanted to give back to a charitable cause that provides resources to frontline providers managing the COVID-19 pandemic. Contributions of $100 or more made to NEMPAC between June 1st and June 30th will be matched 10 cents on every dollar by ACEP. So the more you give, the more we give back. We hope you will take advantage of this incredible opportunity and join fellow ACEP members to support meaningful political and charitable involvement. Eligible charities are getsppe.org, the Emergency Medicine Foundation COVID-19 EM Research, and the American Foundation for Suicide Prevention. That wraps up our federal advocacy updates, so I'll start taking your questions. Remember, you can submit them using the Q&A feature of Zoom on the bottom of your screen. All right, let's wait for some questions to come in. Here's a question. Federal activity on physician mental health seems like a no-brainer. Will aspects of these bills be included in COVID relief efforts? Who are some of our champions in the Senate on this topic? So we are talking to several Senate offices about this. One of them is Senator Tim Kaine in Virginia. He has been interested in this issue for the last several weeks and definitely sees it as a priority. There's other members of the Senate too, but I think they're not really quite as public yet, so we'll update you more on that. In terms of including it in COVID relief efforts, that's really our hope, and we think there's definitely a strong appetite for that. In terms of timing, we were expecting this fourth COVID relief package to be in May, and then it slipped to June, and now June is almost over, and so we're staring at July. The latest we're hearing is that it would be maybe the second or third week of July. Congress leaves at the end of July for month-long August recess and some additional campaigning for the 2020 elections in November. So I think there'll be some pressure to move that through, but at the same time, I think there's less appetite to do a kind of big catch-all bill that's unpaid and that costs trillions of dollars, which some of the other packages were a little easier to get everything into. So I think this one, there'll be more scrutiny and they'll be a little more discerning about what gets in and what doesn't. Again, that being said, I think there's really broad recognition of the important role emergency physicians and other frontline providers are playing in this crisis and of the stress that this is causing them. So I do think if something is going to be included in there, this would definitely be, you know, towards the top of the list on the sort of helping providers category. All right, another question just came in. Does ACEP support additional efforts at the state or regulatory levels that will break down barriers preventing physicians from addressing their mental health? Absolutely. So we are working on efforts to address those barriers. We right now are collecting anonymous stories from emergency physicians about either there's two different kinds that we're seeking. One is if, as an emergency physician, you ever held off on seeking mental health treatment because you were worried about some implications for your career, whether because of state licensing board questions, which can be really intrusive, or hospital credentialing questions. So we're seeking any stories of people who kind of turned down care or declined to seek care because of those fears. And then we're also seeking stories of anybody who did have some kind of consequences in their career as a result of having sought mental health treatment. So there's some states where the medical licensing boards will ask if you've ever sought mental health treatment or taken medications, whereas other states have kind of headed in the direction that ACEP advocates for, which is questions like, do you currently have any conditions that would currently impair your ability to practice medicine safely? And so that's what we are advocating for states to have their licensure questions kind of focus on. And then of course, we're advocating to hospitals to not really use this as part of their credentialing process. We also, one other thing that we've done along with this advocacy is ACEP recently led a sign-on letter of up to 40 major groups calling for protection of emergency physician and other clinicians' rights to have access to mental health care without worrying about all of these consequences. And some of the groups that signed on included the Federation of State Medical Boards, the American Psychiatric Association, and others like that. So that was a really strong showing. That's on our website if anybody wants to take a look at it. So here's another question. Are we effectively breaking through the noise to ensure that pandemic preparedness gets the funding and attention that it deserves? I would say that's probably kind of a loaded question. Right now, the noise is the pandemic, so it's hard to say that we're breaking through that noise to get funding the attention that it deserves. And I think this is going to be kind of a multi-stage thing, right? There's the immediate COVID packages that we've pushed for and have gotten through, and this next one that we're waiting on. And there's the advocacy we've done on the Provider Relief Fund portion of the CARES Act, which put money in $100 billion for providers, both hospitals and physicians impacted by COVID. Most of that's gone to hospitals, so we've been advocating for that to go to physicians, especially emergency physician groups, given the decline in volumes. One of the points we're making on that is, unlike some of the other specialties that have been certainly impacted with lower volumes during the pandemic, because let's say elective surgeries and a lot of appointments have been held off on, have been shut down. Some of them will at least see that delayed care in the coming months resume, and folks that delayed an elective surgery are still going to have that surgery probably. So while they saw declined volumes, let's say from March through August, let's say, they'll kind of make up for it probably and might be a bit busier for the next few months after that than they were compared to past years. Contrast that with emergency care, where the reduced volumes we had in March, April, May, due to people being afraid to go to the emergency department. That's not really, it's not like you'll hold off for 3 months on going to the emergency department if you're having chest pain. You either held off and unfortunately suffered some consequences or damage because of that. And now longer term, we'll obviously have a lot of follow-up care with cardiologists. You're not coming back to the emergency department in October once everything lifts. So we've tried to kind of show why it's so important for emergency care to get some of that funding specifically earmarked to it. It's even more important because a lot of groups who face these volume drops and are struggling because of that are going to be sorely needed if there's a second wave in the fall, as so many expect there will be. I mean, some areas of the country are already having their second wave, or if that's not a second wave, a continuation of the first wave longer than they expected, such as some like Texas, Alabama, states like that. So it's going to need to be long-term. So that's like the short term, we need funding, but then longer term, as in a year from now or in the next Congress, we have a longer term plan for looking at lessons learned, and we already talked about how the Senate Health Committee is already starting some of that work on lessons learned, and using that to shape future legislation and future advocacy about pandemic preparedness. Because I think some of this, we're not going to have the data until another 6 months or a year from now. We won't have the data necessarily of the impact of deferred care. I mean, we have this initial CDC study that showed that was, I think, 20% reduction in visits for heart attacks, but we really need the long-term data to help inform some of our advocacy and even just a federal kind of look back and debrief of how everything was handled and what should be done differently next time, and then figuring out what the infrastructure is needed to help facilitate that. So another question is, where can I learn more about efforts to reach payers regarding the AUCM? So you can download a lot of those materials at acep.org/APM, and you'll see the toolkits that are on there that are being used to talk to payers. If you're part of an emergency physician group, even large or small, especially if you're small, you have an opportunity to take a look at those materials and start talking to payers in your area about this. And the payers that we're talking to right now are both private health insurance companies, like let's say United, and then also state Medicaid agencies. They're starting to look at this as well as these opportunities. Let's see if there's any additional questions. One is, there are doctors in Congress. Are any of them growing more vocal in support of frontline health workers? Quite a few of them are. Congressman Raul Ruiz is an emergency physician from California, and he's been very vocal about this. Congresswoman Kim Schreier is in Washington State, for example, and she's been pretty vocal about this. But we also have members of Congress who aren't physicians advocating, or who have family members, or just have worked with physicians in the past. And I think they all understand what some of the concerns are and are really helping to support or give a voice to frontline healthcare workers. Let's see if there's any more questions. One is, I noticed ACEP is taking a position on some hot button issues. Could you clarify why we are wading into such contentious waters? So I'm just guessing this question is about our medical liability work. Kidding, that's not probably what it's about. No, we are wading into what some would consider contentious waters, but there's been a lot of national conversation and attention on issues that ACEP already has long had existing policies on. One of these is the impact of racial disparities on health outcomes. And so it's not that we're newly taking up these issues. We've had policy on them, and the national conversation has shifted to some of this. And so we are simply reiterating our current existing positions in the framework of this new national conversation. Another area I know that comes to mind for some is I think the administration recently finalized their rule on conscience protections for healthcare workers that allows them to deny care for folks who are gender questioning or others. And that's, again, ACEP has long had policy that, and it's part of the oath for emergency physicians to care for all patients, regardless of who they are, ability to pay, race, gender identity, a whole bunch of other considerations. So that rule by the administration, it not only allowed healthcare workers to opt out of caring for patients that they don't want to, but it also didn't require them to provide ensure that they have any type of care by other healthcare workers if they themselves are opting out. So that was really concerning to ACEP, given that it could essentially result in a patient not just being denied care, but then being left with no options for care by anybody else. And that's obviously not something that we would want to endorse. So that was another place that we jumped in. So again, we aren't taking up new positions. It's really that the national focus has shifted to areas that ACEP has already previously developed policies on as part of our council process. Again, you know, ACEP forms these policies through our council, which has broad representation from emergency physicians across the country who hold a diversity of views. So those policies are representative of ACEP's membership because of that council process. All right, last question. There's so much going on. How can I subscribe to the ACEP 911 update? That's actually really easy. You should be able to go to acep.org/911 and you'll see resources there and an area where you can sign up to get our 911 update, which for those of you who don't know what it is, it's just a weekly email newsletter summarizing everything that happened in DC, both in Congress and in the administration, and what ACEP is doing to advocate for emergency physicians and the patients y'all care for. And so you'll get that once a week, and then occasionally, much less often than once a week, you'll get one of our alerts where we might reach out to you and ask you to click on a link and use the form to send an email to your member of Congress pushing for something that ACEP has been advocating for. So for example, we had sent out through our 911 network an alert to get co-sponsors on that medical liability protections bill that I told you about in the update. So that's kind of how we use the 911 network, and you'll get those weekly summaries and just you'll learn about other ways that you can get involved and help advocate for the profession. So that's it. Thank you everyone again for joining us, and hope to see you in 2 more weeks. I'm Laura Wister. Thank you.